Hi, and welcome to today's video. In this video, I will be talking about another common type of cancer seen worldwide, which is the bowel cancer. We have already talked about breast and lung cancers, and you can watch these videos on our site. Please don't forget to share our videos as they can help family, friends and other people around you. Bowel cancer is one of the most common types of cancer in the world. Bowel cancer is also known as colorectal cancer, and it can develop anywhere in the large bowel, which includes the colon and rectum. Rectum is the lower part of the large bowel where stool is stored before it is expelled from the body during bowel movement. Bowel cancer develops when there is uncontrolled growth of abnormal cells in the colon or rectum. It often starts as small polyps, which can become cancerous over time. The exact cause of bowel cancer is not fully understood, but it can be caused by lifestyle or diet, genetic changes, and environmental factors. There are certain factors that increase the risk of getting bowel cancer, and these include being over the age of 50, smoking, being overweight or obese, and positive family history of bowel cancer. Having certain medical conditions can also increase the risk of bowel cancer development. It is thought that inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, bowel polyps, Lynch syndrome or familial adenomatous polyposis can increase the risk of bowel cancer. The common symptoms of bowel cancer include changes in bowel habits, blood in stools, unexplained weight loss, abdominal pain or lump, bloating, and fatigue. The changes in bowel habits can present as having softer poo, diarrhea or constipation that is unusual. It should be noted that bowel cancer can cause anemia, which can lead to tiredness, breathlessness and headaches. Bowel cancer screening is a test that can be done at home to check for signs of bowel cancer. It is usually offered to people who are over the age of 54, but this can vary from country to country. Since having blood in stools could be a sign of bowel cancer, the screening uses a test called FIT or fecal immunochemical test to look for blood in a sample of poo. Bowel cancer screening or FIT test is not enough to diagnose bowel cancer. The main test for bowel cancer is a colonoscopy to check inside of the large bowel with a probe and camera. If bowel cancer is confirmed, the treatment depends on the size of the cancer, its exact location, if it has spread or metastasized, genetic involvement, and the age and overall health of the person. The treatment options are surgery, chemotherapy, radiotherapy, and specialized or targeted medicines, and immunotherapy. Surgery is the main treatment if the cancer is localized in one area. This may involve removing part of the colon or rectum. Chemotherapy is designed to kill cancer cells. This can be used after the surgery to stop the cancer coming back. It can also be used if bowel cancer has spread to other parts of the body, or if surgery is not an option. Radiotherapy uses radiation to kill cancer cells. This is more commonly used for rectal cancer, either before surgery to shrink the cancer or after to prevent recurrence. It can also be used if bowel cancer has spread to other parts of the body. Targeted therapy and immunotherapy are used for advanced bowel cancer to block cancer growth or help the immune system fight cancer. It is not always possible to prevent bowel cancer, but there are certain measures that can be taken to reduce the risk of getting it. It is recommended to eat a healthy diet with at least 5 portions of fruit and vegetables a day, to do regular exercise, to lose weight if overweight, to avoid smoking and excess alcohol, and to eat less red and processed meat. Early detection of bowel cancer through bowel screening greatly improves survival rates. It is therefore advisable to see a doctor if there are symptoms such as changes in bowel habit, blood in stools, abdominal pain or lump, unexplained weight loss or tiredness. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.